We are presenting here an additional set of questions that Dr. Wagner has kindly agreed to answer for us. So, Dr. Wagner, for part 2 of your questions, here we go.
Okay.
Question number 19. What infections are you referring to that are prevented during pregnancy? Urinary tract infections, colds, flus, others.
So we looked at any infection, but the vast majority of them in the women during pregnancy in both our NICHD and our Thresher Research Fund trials were bacterial vaginosis.
Okay.
And probably the second one below that was UTIs. And really, very rarely did we have women with flu. We did have some with colds, but the vast majority of infection that was recorded in our 2 studies were the bacterial vaginosis and urinary tract infections.
And the effect of those on the pregnancy, Dr. Wagner?
Well, certainly urinary tract infections and bacterial vaginosis have been linked with higher risk of preterm birth. We also know that if a woman has bacterial vaginosis, when she ruptures, that the infection can ascend into the uterus, into the various compartments surrounding the fetus, into the amniotic fluid, and so that becomes the risk factor for any pregnancy.
Fantastic. Number 20, does an obese pregnant woman need the same amount of vitamin D as a pregnant woman of normal body weight?
So at least the same amount, and if you look at how much vitamin D, so in pediatrics we always prescribe medications, milligram or international unit per kilogram, except for vitamin D. And so a prenatal vitamin has 400 international units. We recommend 400 international units for a 3-kilogram baby. We recommend 400 international units for a 2-kilogram baby. We recommend, the recommendation by the Institute of Medicine is for 400 IUs for a 60-kilogram woman, a 70, 80, 90, 100-kilogram woman. But what we know is that when you have adipose tissue, higher amounts of adipose tissue, the vitamin D, actually the fat, is a sinkhole for the vitamin D. And so we know that obese women may need more vitamin D to achieve the levels, the 40 nanogram per ml minimal level during pregnancy. And that's really why a woman needs to have an idea what her level is before she gets pregnant, preferably, but certainly early on in pregnancy.
Fantastic. All right. I'm interested in knowing more about the natural increase in vitamin D blood levels during pregnancy. How does vitamin D deficiency affect this?
Well, you're talking about the 125 levels. That's the natural increase. So certainly by 8 to 10 weeks of pregnancy, a woman's active form, the hormonal form of vitamin D, the 125, is 2.5 to 3 times greater than what it is in a non-pregnant state. And so if you are vitamin D deficient, you can't reach this optimal conversion of 25 to 125. So at no other time during the life cycle do you see this association. It's only seen in pregnant women and in the fetus and the newborn, where you have such exquisite linkage between the 25 and the 125. Typically, in the non-pregnant state, you will maintain your 125. You can actually have normal 125 levels and be severely 25 vitamin D deficient. But in pregnancy, there's a very, the linkage is so strong that it's really imperative for the pregnant woman to avoid vitamin D deficiency because you're limiting your conversion to 125.
Thank you. Number 22, what level should a woman have prior to conception The next question, part of that, though, I think is key. How often during pregnancy should one have their vitamin D assessed to achieve the correct level? And then when should a newborn be tested for their vitamin D status?
Okay, so I think that based on our studies, finding out if your level is 40 or less early on when you find out you're pregnant, you know, again, if you're planning to get pregnant, I would find out what your level is before you start that process. But let's say, you know, you find that you're pregnant. So as soon as you find out that you're pregnant, if you haven't had a level, I would get one. Now, if your level is at least 40, then I think you can continue on that. But if you're not getting the sunlight exposure, then, and maybe it's summertime, I would recommend taking 4,000 international units a day. If you do that, then you really don't need to have another level checked. We already know that, you know, you're going to reach steady state by 2 months, and that the level will be safe. But if you're worried, then I would suggest getting another level, let's say 2 to 3 months after you started taking the 4,000. And as far as the newborn, so the newborn the level is going to be about 0.7 to 0.8 of what your level is. And so if you wanted, you could maybe have someone draw a level from the cord blood, or if you're trying to find out, you know, what your baby's level is, that would require a blood draw. Typically, you know, you can do a heel stick, but usually they're going to get it from a vein, unless they get it from a cord blood. And we've found even in severely vitamin D deficient newborns, if the baby is given a vitamin D supplement, they certainly have normal levels by a month. If you're exclusively breastfeeding, or if your baby's formula fed. So I don't know if that answered the question fully or not. Carol, you might ask.
I think that's a good stab at it. Printed question. Thank you. And then, is there a relationship between vitamin D levels and pregnancy-induced hypertension?
Yes, there really appears to be. We saw the trend again in our 2 studies. In the treatment groups, we certainly saw that when we looked at composite comorbidities of pregnancy, when we combined the databases, and also in the Thrasher Research Fund study. We also have, there's very good papers, again, I mentioned Lisa Wagner's. So pregnancy-induced hypertension, so the severe form of that is preeclampsia. And there's 2 papers by Chris Robinson that have shown these associations. So I would say that, yes, and if you have a history of chronic hypertension and you're now getting pregnant, you're particularly at risk for developing superimposed preeclampsia or worsening hypertension during your pregnancy. So you really want to make sure that you correct your vitamin D deficiency as early in the pregnancy as possible.
Thank you very much. And the last question that we're going to do on this series is number 24. I'm 29 weeks pregnant, and even though I know about vitamin D and benefits, I am afraid to take any extra in this pregnancy because I lost my last baby at 14 weeks, and I was taking extra 2 to 4,000. I need academic reassurance to overcome this mental overreaction.
Well, I would certainly recommend that this woman, that she get a vitamin D, 25 hydroxyvitamin D level checked. And, you know, I think that she could start very conservatively at 2,000. And I would say that it's probably, you know, in this case, I mean, we're talking about at least, we had 160 women in the Thrasher. We had 350 women in the NICHD trial, and they all weren't on 4,000, but we're talking about half of the women in the Thrasher, so 80, and a third of the women, it's over 100. So close to 200 women, we didn't see that. Again, you know, we're not talking about hundreds of thousands of women, but based on what we know about vitamin D and the pharmacokinetics, I would say to have your level checked, and if you're low, perhaps that's why you maybe you really needed more. Maybe you were vitamin D deficient, and that's why you miscarried. Or it could be that it was a genetic problem and had nothing to do with your vitamin D status. So I think that you need to really look into that. And again, you're now 29 weeks pregnant, so clearly this pregnancy is very different from the 14-week loss that you had earlier. But I would urge you to get your level checked.
And that seems to be the ongoing message, doesn't it? Get your
Yes.
level checked and get your level checked.
And
Thank
I have
you
to
again.
say, yeah.
Sure.
Oh, one other thing I just want to say that I'm not. I'm equipoise. I don't have any financial gain. I'm not associated with any company that does testing or that manufactures vitamin D. So when I say this, I'm saying it as a clinician, as a neonatologist, as as somebody who really wants people to be healthy and for their own well-being. It's not from personal gains. I just want to make sure that's clear.
Thank you, Dr. Wagner. I do have one other thing to ask you to speak just a couple of minutes about, if you would. We, Grassroots Health, with your guidance and that of others, we're launching a Protect Our Children Now campaign, and this is to get 1,000 women in any community. We have a couple already selected to, with these pregnant women, to get their vitamin D tested and participate in a project to get themselves replete and to test the status of their newborns, and then essentially to develop an action group to say, okay, everybody in the community and the world needs to make this happen. So, Dr. Wagner, if you could say, what effect do you think it will have if we could really, really, really get communities to adopt this and move forward with solving the D deficiency epidemic amongst pregnant women?
I think that we're going to see an improvement in overall health. And it's not just during pregnancy, although I think as a neonatologist, that's where it all begins. And so it's, of course, the most important because it lays the groundwork for future health status, immune development, and so forth. But what we're going to find is as women participate in this study, they're going to become empowered. They're going to have knowledge about their vitamin D status. They're going to see what happens as they take the vitamin D, and they're going to look at the levels. And instead of having it a black box, you're going to have a cause and effect relationship. You're going to see that. And, of course, oftentimes the more questions you ask, the more questions you get, and so forth. But at some point, we're going to really, our knowledge about vitamin D as the pre-pro hormone and our understanding as a society will mandate that we treat deficiency. And by having each individual take ownership of their own vitamin D status and to be able to seek out the answers to their questions, I think that overall health, not only just about vitamin D, but in general, to do something that's healthful for you, whether it's exercising or to correct a deficiency, I think those are so essential. And I see this coming out of this endeavor, which is, again, created by people who are concerned about health with no other objective but improving the health status, in this case, of pregnant women and their developing fetuses.
Wow, marvelous. Thank you again for all of your work, and we will have additional webinars coming up with other topics. Thank you, Dr.
Great.
Wagner.
Well, thank you. Yeah, thank you so
bet.
much for including me.
Absolutely.
Okay, bye-bye.